Anxiety is characterized by irrational fear and feelings of helplessness affecting millions of people all over the world. And doctors say understanding the neural mechanisms behind it is very important when it comes to developing effective treatments. Joining us now to talk about that is Med Team doctor and infectious disease expert Dr. Ed Dominguez. Dr. Ed, past research has shown anxiety can be linked to changes in the brain's prefrontal cortex. What kind of changes are we talking about, and how can targeting this particular area of the brain impact treatment?
Well, the changes we're talking about, Blake, turn out to be activity changes, the amount of oxygen and blood flow that goes to the prefrontal cortex in people who have major anxiety. It turns out in a Chinese study looking at several hundred people with anxiety and using a non-invasive type of scanning, they found that there was decreased levels of activity and blood flow in that part of the brain. Why is that important? Well, we can use that as a marker of disease. We can treat people, and if we see increased activity, that tells us that drugs are working. So we now have something with which to monitor therapy.
All right, and another study is finding there may be a link between predicting dementia risks and predicting depression. How can the 21-point brain care score used to detect dementia or stroke risk point to a person's risk of developing depression later on in life?
Well, this brain care score, or BCS, looks at several different factors, things like blood pressure, cholesterol, BMI, whether you're a smoker or not, a drinker or not, a lot of modifiable risk factors. And the higher the score, the better, the lower your risk for developing these complications, as you were suggesting. So now that we know what goes into that score, we can also adjust our risk for long-term depression by avoiding things that lead to a lower score, like smoking or drinking or obesity.
Dr. Ed, the CDC sticking with its warning over sliced deli meat that's being linked to a deadly listeria outbreak. That bacteria is now being blamed for 2 deaths and 28 hospitalizations across 12 states. What are some signs to look out for here, and what can someone do if they think they've contracted the illness?
Yeah, I've treated quite a few people with listeria during my career, and the major symptoms that we see in people that present, Blake, are going to be gastrointestinal symptoms, nausea, vomiting, diarrhea. But in people with high risk, for example, pregnancy, low immune systems over the age of 65, fever, headache, stiff neck, confusion, because people can develop meningitis and sepsis from this. The thing to do is to go to a hospital pretty much immediately. We have effective therapy, but we want to start it early. It leads to about 250 deaths a year, and these are potentially preventable. Unfortunately, there are no vaccines for this infection.
All right, Med Team Dr. Ed Dominguez, our thanks to you.